Good day. I realized that the last time I didn't really give enough examples about the different providers working at the different levels of care provision. So I thought I may as well just do a quick run and give examples. Yeah, so we'll start at the basic level, the primary level, and this is where you find small clinics, health centers, primary health centers, and then this level is mainly manned by general practitioners, also called family physicians. Here you also have the internal general physicians and the pediatricians. And then you move on to the secondary level, where you have most of the general hospitals and some private hospitals as well. Yeah, at this level you really find the hospital-based specialists, and you have the likes of the cardiologists, the general surgeon, the obstetrician, the orthopedic surgeon. You also have the radiologists. And then we'll move on to the tertiary level of care. This is where you find the teaching hospitals, for instance. So here you find super specialists, the likes of the interventional cardiologists, interventional radiologists. You have the intensive care specialists. You also have people like the surgical oncologists, psychiatrists, ophthalmologists, the ear, nose, and throat specialists. And these are some of the specialists you find at the tertiary level of care. And then, of course, at the quaternary levels, you tend to find a mix, an array of the different doctors and specialists and super specialists, all involved in research activities, usually geared towards a specific condition. Now, besides this group of doctors and specialists, it's worth noting that they are actually surrounded by an army of other providers, allied health providers and nurses that keep the wheels of healthcare spinning. And in fact, the truth is that the doctors will be lost without these healthcare providers. So I think we're very familiar with hardworking nurses, but besides the nurses, you have others. You have the medical lab scientists, you have the X-ray technicians, radiographers, you have the likes of the dieticians, the exercise physiologists, the physiotherapists, the podiatrists, the speech pathologists, the occupational therapists, and many others. Yeah, so these are very hardworking healthcare workers, usually, at the background, just helping. But I think it's really worth a mention. And maybe during our next discourse, I would, just give brief examples of what each of these allied health workers do. Thank you for listening. Again, my name is Dr. Elvis. I'm a specialist general practitioner. My practice straddles Australia and Nigeria. Thank you.